Hi, I'm Kevin Barrett. I'm a vascular neurologist at Mayo Clinic in Florida, and what I wanted to share with you today is some of the increased medical risks that can occur during the holiday season. For many people, the holidays are an exciting time. It's filled with hustle and bustle, but if you're not careful, there can be increases in medical risk that in many cases can be avoided if you're aware of those risks. We have noticed through several studies that the incidence of heart attack and stroke is increased in the months of December and January, and actually at two specific times during each of those months there's an increased risk of stroke and heart attack on Christmas and New Year's Day. Many people believe that some of the stresses of the holiday season can actually change physiology and cause increased levels of stress hormones that can lead to increases in blood pressure, which can subsequently translate to heart attack and stroke. Often people may have lapses in the way that they take their medications because of the competing interests that occur in terms of scheduling and so forth during the holidays. And we also see that the shorter days and longer nights during December and January may also play a role in changing the levels of stress hormones in the body. Another common thing that can occur during the holiday season with parties and holiday get-togethers is there can be indiscretions with both food and alcohol intake that can increase one's risk. So the question is, how do we avoid these risks? How can we minimize some of the risks that we know occur during December and January during the holiday season? One thing is to avoid delays in seeking medical attention. This is something that can be done easily through being aware of common symptoms associated with heart attack and stroke, chest pain, shortness of breath, sudden loss of vision in one or both eyes, sudden weakness on one side of the body, sudden inability to talk. All of these can be important risk symptoms for heart attack and stroke. If any of these occur, one should call 911 and be evaluated urgently in a local emergency department. That's the number one thing that we can do to prevent heart attack and stroke during the holidays, is to avoid overlooking important symptoms. Second, being vigilant with your medications and not missing doses. And third, being careful around the holiday dinner table and being careful with excessive alcohol intake during the holidays. These are practical things that one can do to try and offset the risk that we do know occurs in December and January.